Hi everyone, welcome back to Minute Massage. My name is Kathy Desai Seltzer. I'm the owner of Vyana Infant Massage, where we teach parents the art and science of baby massage to alleviate gas colic, improve sleep, congestion, immunity, brain growth, breastfeeding relationship, and so much more. We are actually continuing the conversation this week about home births and how to have a pain-free birth, and I'm really excited to be talking to Karen Welton today of Pain-Free Birth. She's going to talk all about her experience, what she sees are some of the challenges that moms face in America, and what great resources and advice she has for moms who are considering having a pain-free birth at home. So welcome, Karen.
Hi, it's so glad to be here. Thank you.
Sure. And as I've mentioned to you personally, and folks know, I'm especially interested in this because I'm also expecting. And so we talked a little bit last week about the challenges around maternal mortality in America. I want to continue talking about that a little bit because a lot of the things that we are learning or the causes are preventable. And Karen's got a wealth of knowledge about how we can prevent them and why they're happening. And then we can also talk a little bit about what resources Karen has to support you. So let's get started.
Awesome. All right.
So Karen, let's start with, tell us about what you do, what inspired you, and sort of what's your story? What's your story?
Yeah, I'd love to. Well, what really got me started in becoming a birth junkie, so to speak, is obviously, like a lot of other women in this space, I got pregnant and went on a journey this was about 8 years ago, and really had to walk through a lot of the fear in the culture surrounding birth and maternity care and the culture of birth and obstetrics in this country. I'm in the US, and so I felt like there was so much fear and this notion of like birth has to be painful. And so I actually began questioning that narrative. I said, why does birth have to be painful? Why do we have to experience pain and trauma and this suffering? And the more I questioned it, the more I found amazing resources like Ina May Gaskin and understanding the physiology of labor. So I moved from a place of fear to a place of faith and empowerment in that first pregnancy. Where that led me personally was moving from a hospital birth with a group of midwives that I loved, but I felt led in my spirit to look into water birth. And the only way to have water birth in my area was to do a home birth. Okay. So lo and behold, I found myself with a home birth midwife, having a home birth of my first baby, and really challenged myself in saying, like, why would I wait to my second birth to have the birth I really want? Because I think a lot of women have this idea that hospital's safer, have your baby in the hospital the first time and then maybe have a home birth or birth center birth or what have you after.
Right.
And I said, why would I wait? If this is where my intuition is leading me, I have to trust that that's guiding me for a reason. And I owe it to myself and my baby to look into that possibility. And the more I did the research and understanding the statistics and the actual risks of home birth versus hospital birth, and watching documentaries like The Business of Being Born, and what the real risks and the cascade of interventions, and the infant and maternal death rates, and how statistically home births are safe, just as safe or safer than a hospital birth. So but more importantly than that, on a deeper level, I got to a place of having a deep confidence in my own body and my body's ability to birth.
Okay.
Because I think so many women, it can be very easy to get caught up in this like over intellectual birth preparation of understanding everything that could go wrong in labor, and all the interventions and all the restrictions and all the complications. And we can get obsessed with what could go wrong and what we should do. And it can be from a good place of learning to advocate for yourself and being informed and well-educated, an educated consumer. But I think we can also get lost in that journey if we're not also fascinating ourselves with how good birth can be. Absolutely. and what our bodies are actually capable of. Yeah. So I began to study and become obsessed with the natural physiological process of labor and how that worked and how to connect to my body, how the hormones of labor worked, oxytocin, how it counteracts adrenaline. And I learned a lot about how that fear, tension, pain cycle, and how fear in birth, even our expectation of pain or fear of something going wrong, causes tension in the body. And then that tension, when your body's contracting and working hard, that tension manifests as pain. And then when you experience pain, you get scared, right? And you brace for it.
Yeah.
And then you get more tense and more pain. And it's this like downward spiral.
Absolutely.
Yeah. So I found myself doing that in early labor with my first. I was bracing for it. And this is like middle of the night, contractions are coming, it's early labor. And I know it's early labor. And I'm thinking, okay, this is not working. If this is what it feels like now, it's going to be really painful when it's like in transition, right? And so I prayed, and I just felt like this impression, relax, sink into it, embrace it. This like very strong impression to embrace the contraction. And I'm like, I don't want to embrace it, it's going to hurt. Right. Like your mind is like, my mind is arguing with itself. Yeah. It's like counterintuitive.
Right.
So, but I said, okay, fine, I'll try it. So it starts to swell, like, you know, and for women who ask, like, what does it feel like? Pain-free birth is not like you're numb. It doesn't mean you can't feel what's happening in your body. Like I felt everything. But when I embraced that contraction and the energy in my body, it's like a surge. Many women call it the surges instead of contractions. And as it built, I welcomed it in. And instead of bracing for it, I relaxed into it and welcomed it and absorbed the energy into my body and let it spread throughout my whole body. So it took a lot of concentration at first to like at a cellular level, not just every muscle, but every cell to receive this power going through me. And when I did that, it didn't hurt. It swelled. I felt the tension. I felt the stretching and the contraction of my uterus. And I felt it swell in my body and get really strong and then fade away. And it was like a wave rolling over me, but it wasn't painful like it was the contraction before it. And so essentially I learned to do that in my birth, and the next one wasn't painful, and the next, to the point that I was 8-9 centimeters in labor, laughing, saying, I'm having fun. Because I realized it really works.
And that was without any nitrous, you know, it wasn't
right,
like
no drugs. This is home birth, no epidural, no drugs. I was in my living room on my hands and knees with my doula squeezing my hips saying, I think I'm having fun. And they're like, this girl is crazy. This is not a normal birth. But I also knew, like, okay, it's not just a theory, you know, I could feel it in my body. I knew, like, this is real active labor and it's working. And I got so happy. So now, like, I even know, looking back now, I can see, I released a burst of endorphins that made me really happy, and oxytocin, and those blocked pain receptors.
Right.
So the happier you get, the more joyful you are, the more you partner with the physiology of your birth, the more joy you experience. Because pain-free is just like one aspect of birth, but you can have transcendence. There's orgasmic births that women experience. There's joy, there's euphoria. It's a very spiritual, a transformative experience, and it is the most empowering thing I've ever done. After my baby was born, I felt that huge burst of oxytocin, the bonding, and I just fell in love. I was like enthralled with my baby for weeks afterwards. I had those oxytocin highs, learning how my body was releasing it, and learning when that stress or fear came in, how to process that so that I didn't dwell on it and allow my hormones to dip, you know. And you can even work through postpartum depression, understanding this hormonal physiology.
Absolutely.
And so I got to the point of saying, women are being lied to, and birth is so much more than we're being told, right? Because like you were saying, that we watch these movies and we have this idea of what birth is, and it's women screaming in the hospital room and cursing at their husbands, and this mentality narrative of birth that was created by rich white men who know nothing about birth, telling women this is what birth is. And we grow up with it, and it's like, it's laughable. But then we have friends and family who've experienced painful traumatic labors. And it reinforces that fear.
It reinforces it, absolutely.
It really just comes down to tension. Anywhere you're holding tension in your body will produce pain. And so that tension could come from the pain of the contraction. It could come from, I don't feel safe, I don't feel comfortable, I feel cold or hungry, or I don't like the way my nurse just looked at me, or I feel pressured because it feels like I'm on the clock and my doctor's getting anxious and wants me to hurry up and have this baby. And we have a lot of that in a hospital environment. There's a lot of interruptions, a lot of disturbances. And so that all affects a woman physiologically. It affects her self-confidence, her doubts creep in, and those have an immediate effect on the physiology hormonally of labor. It's one of my clients, I remember very vividly, I asked if I could take a picture of her in labor because I did photography at that time. So at one point she agreed, and then forgot about it. So at one point I take my camera out, she's coming down the stairs, I take a picture of her, and she was laboring fabulously, like very much in her zone, really hard, very strong contractions, but she was managing them great. Well, I take a picture, she notices, it throws her kind of off, she wasn't expecting it, and I think she felt violated. And the next contraction she had was incredibly painful. And she didn't know why. She just thought, oh my gosh, that one hurt so much. She didn't know why it felt that way, but I knew exactly what happened. And I said, oh my goodness, she felt disturbed and unsafe when I took a picture of her and she didn't expect it. So I put my camera away, and the rest of her labor went back to totally normal, the way she was handling it before. And that's how immediate it is. That fear releases adrenaline and tension, which causes pain.
And we know about animals, they often birth at night. When they're alone, when they're away from predators. Like all of these things that you've mentioned are almost like predators, the lights and the not being able to eat, and all of those things. It feels predatory. It feels like you can't be vulnerable. And is there any more vulnerable experience than giving birth, right? So
absolutely, yes.
And that actually is a great transition. We were talking earlier, Karen, and so we're hearing that maternal mortality is actually rising in America, and as a developed industrialized country that has so much money to spend, we have terrible outcomes. I know I hear about these stories. I know personal stories of women who have died in or after childbirth, and so I'd love to hear from you on some of those common causes, which we know most of them are all preventable. I think 80% of them. What's happening and why is that happening?
It is fascinating. As a large industrialized nation, we spend the most on maternity care, and yet we have the highest rates of large industrialized nations of maternal and infant mortalities. Michael O'Donnell has spent a lot of time researching this, and he has some fascinating articles and research about that. If you look up birthbythenumbers.com or .org, I'm not sure. He really essentially does grand rounds and teaches on the problem of the high cesarean rates and the high infant and maternal deaths. And many people in the medical community want to point to women and say, oh, it's women's fault. They're older, or they're not as healthy. Not as healthy. And you have all these blame shifting theories of why these rates are high. And he essentially says, no, has nothing to do with women. It is the culture of obstetrics. It is the culture of fear. It is the high risk culture. It is the liability culture, and it creates the complications, the problems that we see in maternity care. And when you understand that with the hormonal physiology of labor, and Sarah Buckley's done a lot of amazing research on this, the hormonal physiology of labor, when you understand that, you can see exactly how this culture disrupts a normal physiological birth and creates complications. So for example, like you said, hemorrhaging, bleeding is normal in labor. And that's often a lot of times what people say, oh, well, what if you bleed out and you're having a home birth? Aren't you scared of that? Or of something happening to the baby and an emergency and all those things? Well, actually in a hospital, there's so many interruptions. What you see more often is hemorrhaging is very common in hospitals. It's almost unheard of in home birth. It's very rare in an undisturbed home birth, I should say, because there are home births that are interrupted and have disturbances as well. But what causes hemorrhage is and oftentimes fear when you look at it. And of course, there's many different medical reasons, but most often it's having a labor with a lot of interventions, a lot of disturbances that create fear in the mother's body, especially when you have forced pushing and you've got a mother being forced to push for 2 to 4 hours, hold your breath and push. There's so much tension in the body, or Pitocin use. The uterus is working so hard for so many hours unnaturally. And when birth happens, if there's too much adrenaline in the body because of fear and all these disturbances and interruptions, it prevents the body from releasing oxytocin, because adrenaline and oxytocin counteract each other. And so when you've got a lack of oxytocin, you need oxytocin in high amounts at labor, at the moment of birth, to contract the uterus, because as we know, oxytocin is responsible for causing uterine contractions in labor and immediately after birth to shrink the uterus. So if you don't have high amounts of oxytocin, it won't contract the uterus and you're more likely to bleed. So bleeding happens when there's been disturbances, women are scared, women have anxiety, and they're not comfortable. But when you have high levels of oxytocin, it works as a natural prevention of hemorrhage. It's built into that process, and it will contract the uterus, shrink the uterus, and the wound will close and prevent hemorrhaging. So it's typically, you see hemorrhaging more often in a disturbed labor, or a labor where the mother feels uneasy or anxious or scared in her labor.
And Karen has had now 3 beautiful babies at home. So she's got a lot of experience. And as I mentioned, she's active on Instagram, has some great resources. You can find more at painfreebirth.com. That information is below. And I'm sure Karen would be more than happy to answer any questions that you all have about what is it like to have a pain-free birth and how can you make that possible for yourself. So thank you so much, Karen, for shedding some more light on what's going on, for helping moms feel more excited and empowered, listening to their intuition, following their natural body's physiology. I think is so important. So this is all science and evidence-based. And hopefully this conversation has inspired more moms to at least look into it and ask the question, what would it be like if? So thank you so much, Karen. Any final words?
Thank you for having me. And yeah, please contact me, on Instagram at painfreebirth or on my website. I'd love to chat with you. And I just love empowering women. So for anyone watching, if you're pregnant as a woman, I just want to affirm you that your body knows how to birth. And even though everything in our world has changed with pandemic and fear and restrictions, your body is the same. It knows how to birth, just like it has. Women's bodies have birthed for thousands of years. Nothing has changed, and you are capable and powerful. And I just empower you to do that.
Those are wonderful final words. Thank you so much, Karen.